The Merck Hypertension Award, my idea is simple. Let's have booths that can measure blood pressure, that can measure height and weight, and then give a patient results and also give them tips on how to manage their hypertension. One of the challenges facing Uganda in regards to diabetes and hypertension, we are having a change in the disease profile. I mean, we have malaria, we have HIV, tuberculosis, and a lot of effort has been geared towards those three diseases. And here there's an increase in hypertension, diabetes, and it is postulated that by 2030, probably non-communicable diseases will have more morbidity and mortality than the infectious diseases which we are targeting.
Diabetes is a holistic disease. It needs a whole holistic management. So I don't have to only look at the drugs perspective of it. I also have to consider so many things like diet and then exercises.
Well, lifestyle and exercise is very important when you're managing someone with diabetes, so you have to come up with a schedule that is convenient for them, and also explain to them what their disease is all about and find out what they know about the disease and where they got to learn it from.
Most of the times these patients come with so many issues at home, social problems, psychological problems, so we need to tackle those issues if we want to manage our patient well.
Today, during the Merck CME, I've learned a lot of information which is so important in my career, since I'm going to be a medical personnel, and it's going to help me a lot in managing the patients and improving the lifestyles of people, especially in the area I'll be serving.
In the Merck CME that I've attended today, I've learned quite a lot of things, but most remarkable, I've learned what they call the meal planning, where you take small portions of each food so that you may not predispose or you may not worsen the blood sugars of the diabetic patients.
I've learned that diabetes kills more people than TB, AIDS, and malaria combined. And I've learned how to manage diabetes and hypertension and their complications.
During today's Merck CME, I expected to learn some of the newer drugs which have been introduced into the market, how they work, and yeah, I've met some of them. And the other expectation which I expected was to maybe learn more of the non-pharmacological management of diabetes, which I've also met because they talked about the exercise and the meal planning.
My expectations have been met. I wanted to learn what is new, what is current, what are they doing that we're not doing yet here in Africa, what are the new diagnostic tests, what are the new treatments and drugs in the market that are coming up in phase 3 trials. And I think the international speaker has tried to really bring out those issues.
Especially I've learned mainly about lifestyle modification, especially in meals. That I'm going to educate the patients about making sure that half their plate is vegetables. In Uganda, it's not a common culture, but I'm going to make sure that I advise them for their good health.
Plan to use the knowledge that I've acquired from Merck is first of all to discuss with my colleagues so they may also know the relevance of diabetes. And also when I'm faced with any patient, know that everyone is at risk, and if I can modify that risk so they don't proceed to diabetes, I'll be doing a much great job.
I want to use this knowledge to prevent people who have impaired glucose tolerance from getting real diabetes mellitus. And I also want to use this knowledge to prevent hypertension and diabetes in my patients.
And so my thinking and my personal take home is, can we have some of those researches they are talking about done right here in our College of Health Sciences by us students and see the outcomes so that we can also have a contribution to the big knowledge of science out there on diabetes and hypertension.
I just thank them for the CME. It has been nice, it has been educative, and we ask them to come back more for more CMEs.